So if you're just joining us here, we're interviewing Dr. Bill Jensen, and Dr. Bill is the CEO and founder of Premier Wellness Centers located in Port St. Lucie, Florida. And in your professional opinion, Dr. Bill, how often do you recommend people get chiropractic treatment?
Well, it depends on, where they're at, what problems they have, and what their goals are. So, when patients come into our practice, again, what we typically say is like, what are your goals? So their goals might be, doc, I got back pain, I got neck pain, I have this problem, and my goal is just to get rid of that symptom and get back to life again. Okay, sounds good. So, if I have pain in my neck, it's going down my arm, and I can't sleep at night, and it's affecting my ability to work out or concentrate and work or spend time with my family, I'd come in every single day, twice a day in some instances, and make sure that got treated to get that out of there as fast as possible. Some people don't want to make that commitment or don't have the time or a way to do that. I'm blessed and lucky to work in the practice I do. Of course, it's a little advantage, but at the same time, we'll recommend maybe, either daily or 4 times a week or 3 times a week. That's more aggressive care to get their symptoms under control. Now, if a person's looking to correct a problem, they got a 15-degree curve in their back and they want to straighten that up, or they want to rehabilitate their body so that not only does the problem feel better, so it gets fixed, we'll treat 2 to 3 times a week for several weeks, dozens of visits potentially over weeks or months in order to get their problems fixed, rehabilitated, and stabilized. As far as supportive care, that's always the stigma, right? So patients go to a chiropractor and say, I heard once you go to a chiropractor, you always got to go to a chiropractor. Well, it's just a fact of matter that we have to resist gravity every day. We have stresses in our lives. We are constantly moving every single day. I mean, you don't hear people saying, once you go to the dentist, you always got to go to the dentist. It's just that if you want to have clean teeth and healthy teeth and not have them fall out later in life, you're going to have to brush them every day. You're going to have to floss, and you're going to have to maybe get them cleaned, every 6 months as they recommend. And the same thing goes for chiropractic. If you want to maintain a healthy spine so it doesn't deteriorate over time, so you lessen your chances of having to have surgical procedures down the road, or having pain or problems, or creating that stress response we spoke about earlier, you got to keep things moving well in your spine. And so supportive care studies show everybody's different, because everybody has a different amount of stress in their life and their body every day. But studies show that every 2 to 4 weeks is a good treatment frequency for somebody to come in, get checked, treat the areas that need to be treated, keep them moving well, lined up well, and for that area, for those areas in the spine to stay healthy.